Assalamu alaikum. Dear viewers, hope you will find. So first of all, I'm very thankful to all my viewers who are watching my lectures on regular basis. So let's take a start today's our new topic that is related to antibiotic classification and mechanism of actions. So today our class is about antibiotic classification and mechanism of actions, which is more important for each and every medical student. Let's take a start. Look at here. These are the objectives which I am going to cover. So already the objectives I have mentioned in my lecture. So the objectives, the first objective is define the most commonly used drug category, and that is used to prevent and treat infection, including antibiotic drugs. Briefly discuss action and effect of antibiotics. List some commonly used antibiotic for each antibiotic category. Discuss the nursing measures, patient education which can be taken if the patient is using to treat and prevent infections. Okay, so first of all I'm going to explain in simple words. Antibiotic can be defined as antibiotic are those chemical substances which is produced by one organism that selectively kills or inhibits the growth of another. And in other words, antibiotic can be defined as these are also known as antibacterial agents. While in other words, it can be defined as medications that destroy or slow down the growth of bacteria. So as we know that there are different type of, there are basically two types of antibiotics. So one is broad spectrum antibiotic and the second one is narrow spectrum antibiotic. So actually these chemical substances can slow down or they can destroy the growth of microorganisms, not only to inhibit the growth of microorganism, but it will kill the microorganism along with their spores. So now we can say that narrow spectrums, there are two types of antibiotic. One is narrow spectrum antibiotic, the second one is broad spectrum antibiotic. So narrow spectrum antibiotic are also known as bacteriostatics, which I have mentioned here. So you can see here in my lecture. So narrow spectrum are bacteriostatics. These are those antibiotic which can only inhibit or stop or slow down the growth of microorganism. So it doesn't kill the microorganisms along with their spores. It can only stop or slow down or inhibit the growth of microorganisms. So microorganisms, it may be in the form of fungus, bacteria, and many and more, certain pathogens. So yeah, those chemicals which are used against infective agents are known as antimicrobial agents. Are those substances which have the capability, which have the ability to kill the microorganism at a low concentration. So this is another classical definition of antibiotic. Now come toward the narrow spectrum antibiotic, which I have already mentioned. Few names of certain group of antibiotic. Let's suppose tetracycline. So tetracycline is bacteriostatic agent. So it belongs to narrow spectrum antibiotic. The second one is sulfonamides. The third one is chloramphenicol. The fourth one is macrolides and lincosamides and spectanomycin and trimethoprim's. So this is the category. These are the groups which belong to narrow spectrum antibiotics, which I have mentioned already. There are some drugs or there are some antibiotics which are bacteriostatic as well as bactericidal. So for example, let's suppose I can give you a particular example, that is sulfonamide. So sulfonamides, it belong to bacteriostatic as well as bactericidal. It has both bacteriostatic as well as bactericidal activity, so depend upon on the condition. So according to the condition, this antibiotic can be preferred. The second one is broad spectrum antibiotic are known as bactericidal. So broad spectrum are bactericidals. These are those antibiotics which have the tendency, which have the capability to kill the microorganism along with their spores. For examples, the good example that is beta-lactam antibiotic. So beta-lactam antibiotics, the good example, one of the excellent example of beta-lactam is penicillin. So that is because if you can review the structure activity relationship of ampicillin, amoxicillins or penicillins, so you can easily find out the beta-lactam ring and its structure. So the beta-lactam antibiotic, because beta-lactam ring is present and the structure of these antibiotics, that's why that is called beta-lactam antibiotic. Okay, now let's the second one, that is what? So the second one is ampicillin. That is ampicillin, amoxicillin, clavulanic acid, and augmentin. So actually the name which is given in the bracket, so this is the brand name, this is the trade names, and which the drug has been sold. Another one is carbapenem. So carbapenem is also broad spectrum antibiotic are bactericidals. Piperacillin and tazobactams, quinolones. So quinolones, tetracycline, chloramphenicol. So these are the different type of group of antibiotics which have a strong broad spectrum activity, or they are also known as bactericidals. For example, quinolones. So quinolones it contain saprofloxacin, ofloxacin, norfloxacin, gatiploxacin, and many and more. So there are certain antibiotics which have broad spectrum as well as narrow spectrum activity, so depend upon on the conditions. Okay, now let's come to how antibiotic work. Now the question is that how antibiotic work. Different antibiotics have different mechanism of actions, and with these drug can directly act upon on that specific site to reach its target site in order to show its pharmacological activities. So how antibiotic works? So there are some antibiotics which work by killing the germs, bacteria, parasite, which I've already explained in detail, that there are certain antibiotics which can kill the microorganisms, so which come under the category of bactericidals, or you can say broad spectrum antibiotic. Mean it has a wide range against certain pathogens, against certain microorganisms. So this is often done by interfering with the structure of the cell wall of bacterium or parasites. Some work, and some of them they work by stopping the bacterial growth, which I have already mentioned and already in previous lectures. Okay, now let's see here. There are some challenges of antibiotic development. The global antibiotic resistance pandemic representative, that is a first antibiotic era, is bad as the pre-antibiotic era. So there is a decline in the development of new antibiotic classes of pharmaceutical companies during their effect and funding to chronic illness with a potential for long-term revenue. Between 1998 and 2003, only 9 antibiotics compares to the 16 new ones between 1938 and 1987. So what does it mean? So it means that with the passage of time, so there are certain challenges of antibiotic developments. We can say, so in the ancient era, so there were different type of antibiotic which were introduced, and they were used against the variety of infections. So now the challenge with the passage of time, new advancements, so more and more antibiotics were discovered. So following 911 in drug companies, they are directing their effect to drugs and vaccine for fighting bioterrorisms. Okay, come toward the history of antibiotic development. This point should be noted that at in the beginning era, so in 1928, Alexander Fleming he noted the modes of genus Penicilliums that contaminating one of his culture preventing the growth of bacteria. So I mean that Alexander Fleming, he was the first person who discovers the first antibiotic in 1928. In 1935, Thomas, so he discovered sulfonamides from the synthetic dye, and then 1941 clinical trials of penicillins that was done by the Florence chains. Okay, dear students, so let's see here. You can see in this slide. The first generation, third generation, second generations, third, fourth, and fifth generation. So these are the different classes of antibiotics which were discovered in different era. So the first generations, that is also called cephalothene. So the first generation, that is called cephalothene. So it is potent activity against gram-positive and mediatory activity against gram-negatives, means that it is potent activity. At that time when first generation antibiotic were discovered, so most of the students, so they are asking me that, sir, how we can differentiate between first, second, third, and fourth, and fifth generation. So a simple answer is that for example, first generation antibiotic, they were discovered earlier than first, then second, then third, and fourth. So it means if we compare the antibacterial activity of first generation with the third generations, so it means that the gram-negative activity of the third generations will be greater than the mean with first generations. So especially if we compare now, look at here. So we can see here first generation antibiotic, it is potent activity against gram-positive bacteria, but it has weaker activity against gram-negative bacteria. Reason is that with the passage of time, new antibiotics were discovered, and especially the space covering. So it was already the space was covered. That, for example, first generation antibiotics show a potent activity against gram-positive, but its activity against gram-negative is weaker. That's why if you compare the first generation with the third generation, so the gram-negative activity of third generation is greater than first generations. So it means that in first generation, it has a potent and strong activity against gram-positive bacteria, but the activity against gram-negative activity, that is moderate, that is slow, as compared to the third generation, fourth generations, and many and more. Now let's hear first generation. It was discovered in 1964, and after that in 1983 the second generation, that was also called hexapyroxene, they were discovered. So it is expanded spectrum of activity and better cell penetration. So it can it can increase resistance to the beta lactamases, and it is slightly less potent against gram-positive and considerably more active against gram-negative. While the third generation, so it was discovered in 1985. So it was introduced in 1985 in that antibiotic is called ceftazidime. So it has improved activity against gram-negative bacteria. So this point is clear here, that in third generation antibiotic, we have discussed that its activity against gram-negative bacteria is greater than against any first generations. So what does it mean? Now further, I'm going to proceed my lecture. So it is better cell penetration and higher binding towards bacterial target. Now look at here the century. So at that is 1964, and then 1983, and then 1984. It means with the passage of time, new agents were discovered, and they show a potent activity against a different type of pathogens. And then in 1994, fourth generation antibiotics were introduced, that is called CP5s, which improve resistance to beta-lactamases, and it has a wider spectrum of activity. So it means that fourth generation antibiotics, they are much and more effective as compared to the third generation antibiotics. So this is clear, it is wider spectrum of activity and higher activity against both gram-positive and against, and as well as gram-negative. So it means that fourth generation, so it has a higher activity against both gram-positive and gram-negative as compared to third. And that was introduced in 1994. So after that, fifth generations were also, but they are still under investigation. So fifth generation, that is called ceftobiproles. So it is approved for treatment of critical infections such as hospital-acquired pneumonia 2013. Now, inshallah, with the passage of time, you will see more and more. As you can say that at the ancient times, so first generation computers, so it was launched, and then second, third, fourth. So this is the excellent example. So that's why we can differentiate between first, second, third, and fourth generation on the basis of broad spectrum activity and narrow spectrum activity. We can classify all these antibiotics into different generations. Okay, so once again, come toward bacteriostatic with bactericidal activity. So bactericidal kills susceptible bacteria. Bacteriostatic inhibit the growth of bacteria, host immune responses necessary to eradicate bacteria. No absolute terms. Action depends on its in vitro growth condition, bacterial density, and test durations. Bactericidal actions necessary, especially in a condition like endocarditis, inflammation, and the inner layer of the heart. Meningitis, inflammations of the meninges, osteomyelitis, and neutropenia, and host immune system not adequate in these sites in consequences of incomplete killing grave. The disadvantages of bactericidal because it has rapid bacterial lysis in meningitis with overwhelming inflammatory response with increased mortality. Advantages of bacteriostatics, so clindamycins and especially and Staphylococcus, so that is effective in inhibiting TSST1 production without excessive inflammatory response. Come toward the mechanism of actions, that how the different antibiotics can start at work. So inshallah, in my next lecture, I will tell you about the classification, the mechanism of action or mode of action of different antibiotics. So thank you so much, my dear students and viewers, for watching my lecture. So if you have any question regarding my lecture, so you can directly email me, and if you need any kind of material, so I'm always available for your services. Wish you all the best.